Hi, and welcome to our Responding to COVID-19 virtual roundtable. I'm Heather Lonks Minty, and I'm the Director of Philanthropy and Engagement for Respond, Inc. We are New England's first domestic violence agency and second in the nation. We've been providing prevention, intervention, and educational services since 1974. So I'd now like to introduce you to three of my esteemed colleagues that are here with me today. Why don't you each introduce yourselves?
Hi, I'm Jessica Brayden, and I'm the Executive Director of Respond.
I'm Victoria Helberg, and I oversee Respond's law enforcement partnerships and our domestic violence shelter.
And I'm Jen Wolter, and I oversee the Community Corrections Response Program and the Community Intervention Education Program.
Great. So today we're here to talk about the COVID-19 crisis and what all of these precautionary measures, such as social distancing, and what are the future impacts mean to those facing domestic violence in the home and the survivors that we serve. So let's start with the basics. Jen, can you tell us a little bit about what is abuse?
Sure. I try to put abuse into a definition. I focus on four things. One, obviously we're talking about a relationship, and there are a lot of different nuances when you're talking about abuse or violence when it comes to someone you know really well. They know what pushes your buttons. They know what gets to you. They often know a lot more about you. And so they have, more to hold over you and to a certain degree. Also, the idea that it is more than just physical. I know a lot of people think of domestic violence or abuse as physical acts, but there's emotional, which can include verbal, different manipulation tactics, social isolation, spiritual abuse, financial abuse. There are a number of different ways that someone can have power over a partner or a loved one. The third is that it is a pattern. We do see it often building in frequency and severity sometimes. So they're not isolated incidences. This is kind of a behavioral pattern, unfortunately. And then the key thing, of course, is that it's really about power and control. There's a lot of misconception around, anger management, impulse control, substance abuse, mental health, a lot of different reasons that people may excuse or reason out that this is happening. But ultimately, it's really someone trying to have more power or control over the other in that relationship.
I think given the current situation, things are going to escalate for our clients and for survivors that are living with abusive partners. Tensions are definitely rising, and the escape to work or the escape for kids to school is no longer there. And so it's 24/7 with your abuser.
I think the one thing that I would want people to know is that when I am invited to speak to groups about domestic violence, the number one thing I ask people to look out for is isolation. When you have a friend, a sibling, a loved one that stops their normal patterns, they don't go out for drinks after work, or they no longer can come to family gatherings, you see that taper off over time. That isolation is a clue that somebody's kind of controlling their behavior a lot of the times. And you want to check in with them and see how things are going. With this whole kind of social isolation movement, we're losing those check-in points, and we don't have patterns of behavior to kind of judge normal, not normal, because now we're living in a really undefined time.
So on that point, Jessica, can you talk a little bit more about the practice of social distancing and how that's affecting victims of domestic violence?
So first off, we completely understand why we're doing social distancing. And this is not to say that we shouldn't for the health reasons. We get it. And we should absolutely follow any expert health advice around social distancing. What we want you to know is that people who are experiencing domestic violence in the home are now at significant risk. They are, like Victoria had mentioned earlier, trapped in a home with their abuser 24/7. And there are a lot of times that people will use these very brief moments of time to contact a domestic violence agency and plan for safety, whether they're planning to stay and they want to be safe or they're planning their escape. That little bit of time can make the difference. In fact, Victoria, you have a story where you worked with somebody for 5 minutes a day on the hotline to plan this very elaborate escape. Could you talk a little bit about that in a de-identifying way?
Yeah, absolutely. That is like a story that I will never forget and still gives me goosebumps to this day. She was a mom with 5 kids, and they were living in a 1-bedroom apartment. And she had been trying to get a hold of a domestic violence provider, and nobody would talk to her because the abuser was in the home or the abuser was due back in 5 minutes. And I thought, wow, that's the whole reason we're here. And so it was this very like intense conversation where we're whispering on the phone and we're, coordinating times to talk the next day. And we were able to come up with an escape plan. And so in that little window of time when he would leave to drive one of his neighbors to work, we got on the phone. We had the police department at her house, at each children's school to pick them up, and then brought them to a local police department and then into our shelter. And so that is a story I will always, always remember.
Wow. 5 minutes a day.
Yes.
In those 5 minutes matter, right? And that's all that person had. Now they don't even have those 5 minutes.
Right.
So if you have a friend or a loved one, sibling, what have you, that you feel like they may be unsafe in the home or experiencing domestic violence, or you just have that sense, now's the time to call and check in on people. Reach out, whether it be FaceTime. There's so many great ways to communicate with people now, right? There's FaceTime, there's Zoom, the platform we're using now, there's a regular old telephone. So call and check in on people. Don't wait to be asked. Say, well, I'm just going to check in again tomorrow. Offer up assistance as best you can, and then follow your loved one's lead.
I think one way that we've been communicating recently is via email. We know that abusers often check telephones and are looking at phone numbers dialed out, but sometimes people have a safe email that they can use. And so we've been using that. And also having them email with a loved one instead of communicating on the phone. And making sure that people know that they can text 911 on their phone, that they don't have to call anymore. So taking little steps like that. But I can definitely say that working with the police department, Respond partners with 6 different police departments now, and the police reports have definitely increased, which we kind of knew that they would. But I think you would see, maybe we have a history with a family who it's always been verbal reports. Things are starting to escalate. There was a police report the other day that turned into a physical argument because the person didn't go to the store soon enough to get toilet paper. And so all of those tensions are just escalating, and they're going to continue to escalate day by day when people don't have money, when they don't have, a place to go. So it really is going to be a really intense time for our survivors and our clients. And, me coming from a background with early childhood, I think of all the little kids who are home now from school and are going to be exposed to more and more of the abuse.
The last thing I would add, as Victoria mentioned, we are partnering formal partnerships with 6 different police departments, meaning we are embedded within those police departments providing domestic violence counseling services. We work with lots of other police departments around the community, but one of the things Victoria teaches both her staff and police departments is to use a danger assessment form. And some of the things that we consider high risk indicators are access to weapons in a home, loss of job, and children by someone else other than the partner. You take all those things and then trap everybody within the home. We have people who are in high-risk relationships to begin with exposure to some of the top things that we consider high-risk indicators. And we have a lot of concern, and we're seeing the numbers rise up through our calls through the police departments.
So do we want to talk a little bit more now about how else Respond is responding? to these needs in the community. So, our community-based programming. So, kind of how have we shifted that to make sure that we continue to serve our clients in this now, isolated and digital world?
Yeah, well, I mean, we're definitely still open and working and, doing everything we can. Obviously we're trying to reduce the traffic in and out of our spaces for sure. Both for our staff and those working with us to reduce the exposure. But, we have had people come in if they are, needing material, physical things. And then a lot of our, regular appointments have gone to a digital form. So our counselors are reaching out over the phone. Those that have access, to use a video platform like we are now, use that as well. So, we are definitely still available, and we're answering the phones. So anyone can call, whether it's, the hotline or for a planned appointment. We're still there and providing every bit of support that we can. There are certain areas we aren't in, like the police departments, like the House of Correction where we work, but we're still in communication with everyone there. As Victoria mentioned, we're still getting reports from the police departments. We're still in touch with lawyers and social workers and DTA and, all of the different agencies that are supporting those that we work with, and trying to coordinate, all those services and the care that they need. And, if nothing else, again, just someone to talk to. We're all going a little stir crazy. So it's nice to be able to reach out and have someone different to talk to and, just share feelings and concerns with. So, our office is still open from 9 to 5, and our hotline is running 24 hours a day.
Yes, this is your reminder, 617-623-5900. That is our hotline. So ring it. We're here 24 hours, 7 days a week. So Victoria, please continue.
So our shelter program is obviously a 24-hour program. It's an emergency shelter. We currently have 8 families in our shelter. And it is staffed 24 hours a day. So there is somebody on site to provide support, to run house meetings, to run group. We're really, really trying to keep things normal for people, and to keep services running for them. And I think so far, so good, obviously adjusting to the new norm, right? But people have been in good spirits. Staff has been, jumping in to really do all that they can to get our residents through this time. And again, like Jen said, we're kind of, we're definitely limiting the amount of foot traffic coming in and out of the shelter. But, we're there 24 hours a day and we're answering the hotline. And that's really important that we're there for our longtime callers and that we're there for our new callers. We're also there for all of our community partners who are calling and saying, like, what are we going to do? How are we going to help people? And so there really has been a great, discussion among community members about how we're going to continue to support victims. Somerville Police Department reached out to ask for some more flyers, to put in the lobby, because they know that people are going to, be coming looking for services. So, just trying to keep things moving. We have a housing program and our housing case manager is busy as ever. Things are definitely slow. Things are happening on the phone, but they're happening. So, like I said, so far so good. And, hoping things continue to move forward and that someday this can all be over, because we need to be out and enjoying spring.
Yes, agreed. Why don't we talk a little bit about what are the long-term effects that this is going to have on survivors?
I don't think we know the long-term effects that this is going to have on the community. And one thing I can say as someone who lived through the economic downturn of 2008 is that the for-profit world and the nonprofit world are so intimately tied. If they experience something, we experience something. And certainly we saw in 2008 the housing crisis, that it made people who lost their homes were taking market rate apartments. The market rate apartments disappeared. There was a backlog in our shelter and folks couldn't move out. So therefore the emergency shelter beds kind of got tied up because there was no place to move people on.
And we're still feeling the effects of that now.
That's true. That's something that we deal with on a regular basis. So too soon to tell what the long-term effects will be, other than, of course, they're going to be severe and significant. And we're going to have to kind of be nimble and try to negotiate it as they come up. I will echo what Victoria said and said the Respond staff has really been rising to the occasion, and the community of which we are a part of, the nonprofit community and our physical communities, have also reached out and kind of collaborated. There was an email, does anybody have diapers? We have families without. Respond doesn't have any babies in their shelter. We were able to release some of those diapers that we don't have an immediate need for. It's all about communities coming together. And we've had past employees call Victoria who are no longer with Respond and say, if you need help, please call me. I'm still trained. I'm ready to come in. I will be happy to help you. And thankfully, we haven't had to resort to that yet. But how awesome is that? That's just a testimonial to the work that Jen and Victoria are doing in the programs, that people are willing to kind of come back and help the organization. The last way is that we could really use monetary contributions right now. There's a GoFundMe page, which is 100% charitable tax donation, that is helping to keep our hotline open 24 hours a day.
If you'd like, you can visit bit.ly/responding to COVID-19, but you'll also find a link on all of our social media platforms as well as on our website.
And I think if you're worried about friends and family, I think we've touched on a lot of the things, certainly the financial burden, especially for those who maybe have been out working and kind of squirreling away some money. Some of that resource is going to shift. It may put things on hold for a lot of people, having the financial resources if they are wanting to, leave a relationship or a living situation. And then again, back to what we said before, is that isolation piece is huge. So we need to keep reaching out to each other, and checking in, because the longer someone goes feeling like they don't have that support, the harder it is to rebuild that. So whether it's reaching out to an organization like us, or vice versa, us reaching out to those we're already working with, and certainly the same for family and friends. Just keep checking in, remind everyone that, we're separated, but we're not alone.
Yeah, that's a great point. Does anyone have any other tips for whether it's someone that's currently feeling unsafe in their home or someone that might be worried about a loved one?
The thing that Jen has been saying all week is to remind people to call and check on their loved ones. So I want to make sure that people really do that, because maybe the person isn't able to go to work. So that was the one time they could call and say, I'm okay. And then just calling our hotline, because we can help people with safety planning. Sometimes I think too that there's a lot of misinformation about the virus out there, and that, one of our clients said if she left the house, her husband said everybody would, die. Like, that's not obviously the case, but if you're isolated and you're not able to kind of see CNN and what's going on, that might just very well be the case and have you scared enough to not even try to go anywhere. So I would recommend that people call the hotline, and reach out to their local police department if they need to.
One of the things that I can assure you of all my years of doing this work is if somebody promises to hurt you or kill you, it is a promise that they are going to make good on. So trust your gut. If you feel unsafe, call 911, call our hotline. We can help you game plan how to stay safe or how to leave or where to go. One of the things that abusers do a really good job of is telling you that nobody will believe you. Shaking your own judgment. Trust your gut. If you are unsafe, reach out, get help.